My name is Keegan Parker. My case study is based on a 25-year-old male who is 5'10 or 70 inches and 195 pounds. Let's get started. So, my patient participates in regular exercise, and he has no history of cardiovascular, pulmonary, or metabolic diseases, nor does he show major signs of either of those. So, for him, he falls in the participates in regular exercise category and onto the far left grouping, which is for no disease and or no symptoms. So medical clearance for him is not necessary, and he may continue to do his moderate or vigorous intensity exercises. His cardiovascular risk factors. For men, the threshold needs to be above 45 years old to be considered a risk factor. So my patient is 25 years old, so that does not let him fall into that threshold. So no, age is not a risk factor for him. Family history. For this to be a risk factor, myocardial infarction would need to be suffered, coronary revascularization, and or sudden death in the father before 55 years old or mother before 65 years old. He has none of the above and has not neither suffered nor have signs or symptoms of either of them, and his family is healthy. So this does not fall as a risk factor for him either. For cigarette smoking, he would have need to be a current smoker or have quit within 6 months or been exposed to environmental smoke. My patient has never smoked before, and nor has he ever been exposed to environmental smoke. So this is not a risk factor for him either. Physical inactivity. For this threshold is for not participating in sport for 30 minutes a day for at least 3 days a week for at least 3 months. My patient has been exercising for 120 minutes a day or 2 hours, 5 days a week for 36 months or 3 years. So my patient has been very, very physically active. So he does not fall in this category either. For obesity, the obesity is measured based on a body mass index. And for that to be an occurrence, the BMI would need to be greater than 30. My patient's BMI is 28.0 based on his height and weight. So he does not fall in the obese category as he is short of the threshold. For hypertension, his systolic blood pressure would need to be greater than 140 milligrams of mercury, and or his diastolic blood pressure would need to be greater than 90 milligrams of mercury, or be on any current blood pressure medication. My patient has a blood pressure of 130 over 82, so he does not fall in either of those category thresholds, nor is he either on any blood pressure medication. So he is not trying to fix it with any proper medication. So no, this is not a risk factor for him either. For dyslipidemia, his low density lipoprotein cholesterol would need to be greater than 130, or his high density lipoprotein cholesterol would need to be less than 40. If the total cholesterol is given, then you can use greater than 200. But for us, my patient was provided the LDL and total cholesterol. So we would typically use his total cholesterol, which is 225, which does place him over that 200 threshold. But also his LDL is 170, which still puts him over his LDL threshold. So yes, the dyslipidemia is going to be a risk factor for him. For diabetes, the threshold consists of the fasting plasma glucose being greater than 126. My patient's fasting blood glucose is unknown. So because it is unknown, we have to assume it's a risk factor. So yes, this would fall in this category. For HDL, it would need to be greater than 60. But HDL is a risk factor that can actually be subtracted out. So high HDL is good and considered a negative risk factor. So if he were to have a high HDL, you could take away from one of the other risk factors previously listed that were as a yes. My patient's HDL is unknown, unfortunately. So because it is unknown, we have to assume it is not above the 60 threshold. So we cannot consider it as a risk factor. So in total, my patient has 2 total risk factors, those being dyslipidemia and diabetes. He tested no for all the other factors, but those 2 were yes. Through proper diet and exercise, that can be fixed, and medication can also adhere to that as well. My patient, through his fitness testing results, previously those are all pre-test results, so now we're on his fitness testing results. My patient scored a BMI of 28.0, as I said earlier, which puts him in an overweight category for the 25 to 29.9. So he is in the overweight or considered overweight for his height and weight. His percentage of body fat, he tested in at 22.4%, which puts him in the 20th percentile or a poor grouping. He can easily get that up through proper diet and exercise. It's just what it's going to take a decent bit, but for someone of his height and weight, that is quite a bit of body fat. For estimated VO2 max, he tested in at 30.7. Again, that puts him in the 5th percentile, which for his age grouping is not very good. It is considered very poor. So he definitely needs to try to get that up, considering he is still young and in the 5th percentile. He needs to work on that. His grip strength, he tested in with a left hand strength of 45 kg and a 50 kg strength in the right hand. So together that puts him at 95 kg for a total, which classifies him in the good category for someone of his age. That's very good. It's a good grouping, puts him right about average with our other groups. His bench press ratio, he measured in with a 1 rep bench press of 275 pounds. So take that divided by his current weight of 195 gives you 1.41, which puts him in the 85th percentile, which is an excellent grouping. So for someone of his weight, that's a very good ratio. Again, for leg press, he measured in at 450 pounds. So that divided by his 195 weight puts him at 2.31 ratio, which is in the 90th percentile, which is well above average for someone of his age. So that is very good. His leg and bench press and leg press ratios are very good. His push-ups, he scored in with a 40. So for a 25-year-old male, that puts him above the excellent grouping, above 36. So again, for basically strength, he is very good or considered excellent for his grouping and his scores. For sit and reach, my client measured in at 35, which falls him in the very good category of 34 to 39. That is for his age, again, very good grouping. So all in all, his possible health concerns he needs to be aware of based on his risk classification. As I said, he's at risk of 2 factors for cardiovascular disease, dyslipidemia and diabetes. Proper medication can help to limit this and or lower the thresholds for these 2 factors in particular. Diet and exercise can also help as well, obviously through proper nutrition and proper exercise and physical activity. Based on his fitness tests, he needs to keep an eye on his body fat percentage and his VO2 max. Again, these 2 tests can be increased through proper diet and exercise. And over time, his body fat percentage will decrease and his VO2 max will increase. For being a 25-year-old male, he still has plenty of time to figure these out and to live the rest of his life and increase and or decrease these factors.